Neet PG Grand Test Set 1 Questions 1 to 25. Question 1. A 28-year-old woman presents with progressive proximal muscle weakness and a heliotrope rash. Which investigation will most likely confirm the diagnosis? A. Nerve conduction study. B. Serum creatine kinase CK. C. Electromyography EMG. D. Skin and muscle biopsy. Answer. D. Skin and muscle biopsy. Explanation. This is dermatomyositis, an autoimmune inflammatory myopathy. CK may be elevated and EMG shows myopathy, but the gold standard for diagnosis is muscle biopsy showing perifascicular atrophy and inflammatory infiltrates. Question 2. In acute myocardial infarction, which cardiac marker rises earliest? A. B. Myoglobin. C. Troponin I. D. LDH. Answer. B. Myoglobin. Explanation. Myoglobin rises within 1 to 2 hours post myocardial infarction, peaks quickly, but is non-specific. Troponins are more specific but rise later. Question 3. Which vaccine is contraindicated during pregnancy? A. Tetanus toxoid. B. Influenza inactivated. C. MMR. D. Hepatitis B. Answer. C. MMR. Explanation. MMR is a lead-attenuated vaccine and should be avoided during pregnancy due to risk of congenital infection. Question 4. A hypertensive patient on thiazides presents with muscle weakness. ECG shows U waves. Likely electrolyte abnormality? A. Hypernatremia. B. Hyperkalemia. C. Hypercalcemia. D. Hypocalcemia. Answer. B. Hyperkalemia. Explanation. Thiazides cause renal potassium loss leading to hyperkalemia, which produces ECG changes such as U waves and muscle weakness. Question 5. Most common cause of community-acquired pneumonia in adults? A. Streptococcus pneumoniae. B. Mycoplasma pneumoniae. C. Haemophilus influenza. D. Legionella pneumophila. Answer. A. Streptococcus pneumoniae. Explanation. Streptococcus pneumoniae is the most common cause of community-acquired pneumonia in adults, producing sudden onset fever, cough, and lobar consolidation. Question 6. Which nerve is injured in a fracture of the surgical neck of the humerus? A. Radial. B. Axillary. C. Median. D. Ulnar. Answer. B. Axillary. Explanation. The axillary nerve winds around the surgical neck and supplies the deltoid and teres minor. Injury causes loss of shoulder abduction and regimental badge anesthesia. Question 7. Which of the following is a tumor marker for hepatocellular carcinoma? A. SAR. B. AFP. C. CA19-9. D. CA125. Answer. B. AFP. Explanation. Alpha-fetoprotein is elevated in hepatocellular carcinoma, yolk sac tumors, and some germ cell tumors. Question 8. Which diuretic causes ototoxicity? A. Furosemide. B. Hydrochlorothiazide. C. Spironolactone. D. Acetazolamide. Answer. A. Furosemide. Explanation. Loop diuretics, especially furosemide, can cause reversible or irreversible ototoxicity, particularly when given rapidly intravenously or with aminoglycosides. Question 9. Which vitamin deficiency causes subacute combined degeneration of the spinal cord? A. Vitamin B1. B. Vitamin B6. C. Vitamin B12. D. Vitamin E. Answer. C. Vitamin B12. Explanation. Vitamin B12 deficiency causes demyelination of posterior and lateral columns, leading to loss of proprioception, vibration, and spastic paresis. Question 10. Which antitubercular drug causes optic neuritis? A. Isoniazid. B. Rifampicin. C. Ethambutol. D. Pyrazinamide. Answer. C. Ethambutol. Explanation: ethambutol causes dose-dependent optic neuritis, presenting as decreased visual acuity and red-green color blindness. Question 11. Most common site of peptic ulcer perforation? A. Lesser curvature of stomach. B. Duodenal bulb anterior wall. C. Esophagus. D. Fundus of stomach. Answer: B. Duodenal bulb anterior wall. Explanation: perforation usually occurs in the anterior wall of the first part of the duodenum, presenting with sudden severe pain and free gas under the diaphragm. Question 12. Which enzyme deficiency causes alkaptonuria? A. Homogenticid oxidase. B. Phenylalanine hydroxylase. C. Tyrosinase. D. Branched chain alpha keto acid dehydrogenase. Answer: A. Homogenticid oxidase. Explanation: deficiency leads to homogentisic acid accumulation causing dark urine, ochronosis, and arthritis. Question 13. Which ECG change is most characteristic of hypocalcemia? A. Prolonged QT interval. B. Shortened QT interval. C. Peak T waves. D. U waves. Answer: A. Prolonged QT interval. Explanation: low calcium prolongs ventricular repolarization, increasing the QT interval and risk of tossades the points. Question 14. The antimalarial drug safe in pregnancy is: A. Primicene. B. Quinine. C. Doxycycline. D. Artemether. Answer: B. Quinine. Explanation: quinine and chloroquine are safe in pregnancy. Primicene is contraindicated due to risk of hemolysis in GHOE-PD deficient fetuses. Question 15. Which is the most common cause of secondary hypertension? A. Pheochromocytoma. B. Renal artery stenosis. C. Hypothyroidism. D. Cushing's syndrome. Answer: B. Renal artery stenosis. Explanation: renovascular hypertension is the most frequent cause of secondary hypertension, especially in young women due to fibromuscular dysplasia and in elderly men due to atherosclerosis. Question 16. Which nerve is affected in wrist drop? A. Median. B. Radial. C. Ulnar. D. Axillary. Answer: B. Radial. Explanation: radial nerve injury, often from humeral shaft fracture, causes inability to extend the wrist and fingers. Question 17. Which is the most radiosensitive phase of the cell cycle? A. G1. B. ACE. C. G2/M. D. G0. Answer: C. G2/M. Explanation: cells are most sensitive to ionizing radiation in the late G2 and M phases due to chromatin condensation and lack of repair time. Question 18. Which part of the nephron is impermeable to water? A. Proximal tubule. B. Descending loop of Henle. C. Ascending loop of Henle. D. Collecting duct. Answer: C. Ascending loop of Henle. Explanation: thick ascending limb is impermeable to water but actively reabsorbs sodium, potassium, and chloride. Question 19. Which is the antidote for organophosphate poisoning? A. Atropine plus pralidoxime. B. Physostigmine. C. Neostigmine. D. Diazepam. Answer: A. Atropine plus pralidoxime. Explanation: atropine blocks muscarinic effects, and pralidoxime regenerates acetylcholinesterase before aging occurs. Question 20. Which virus is associated with adult T-cell leukemia or lymphoma? A. Epstein-Barr virus. B. HTLV1. C. Human herpes virus 8. D. Cytomegalovirus. Answer: B. HTLV1. Explanation: human T-cell leukemia virus type 1, endemic in Japan and the Caribbean, causes adult T-cell leukemia or lymphoma. Question 21. Which condition shows a cobblestone appearance of mucosa on endoscopy? A. Ulcerative colitis. B. Crohn's disease. C. Gastric carcinoma. D. Peptic ulcer disease. Answer. B. Crohn's disease. Explanation. Crohn's disease has skip lesions, transmural inflammation, and cobblestoning due to deep ulcerations and mucosal edema. Question 22. The most common cause of meningitis in neonates is A. Neisseria meningitidis. B. Listeria monocytogenes. C. Escherichia coli. D. Group B streptococcus. Answer. D. Group B streptococcus. Explanation. Group B streptococcus, Streptococcus agalactiae, is the leading cause, followed by Escherichia coli and Listeria. Question 23. Which anesthetic agent causes diffusion hypoxia? A. Halothane. B. Nitrous oxide. C. Thiopentone. D. Ketamine. Answer. B. Nitrous oxide. Explanation. Rapid elimination of nitrous oxide at the end of anesthesia dilutes alveolar oxygen, causing hypoxia unless 100% oxygen is given. Question 24. Which antibiotic inhibits bacterial protein synthesis by binding to the 50S ribosomal subunit? A. Gentamicin. B. Erythromycin. C. Tetracycline. D. Ciprofloxacin. Answer. B. Erythromycin. Explanation. Macrolides bind the 50S subunit, blocking translocation. Aminoglycosides bind 30S, tetracyclines block tRNA attachment, fluoroquinolones inhibit DNA gyrase. Question 25. Which artery is most commonly involved in anterior circulation strokes? A. Middle cerebral artery. B. Anterior cerebral artery. C. Posterior cerebral artery. D. Basilar artery. Answer. A. Middle cerebral artery. Explanation. Middle cerebral artery infarcts cause contralateral hemiplegia affecting face and arm more than leg, sensory loss, and aphasia if the dominant hemisphere is involved.